Okay, well, welcome everybody once more. Welcome to this second Sustainable Society Democracy and Governance Lunch Webinar. For those who haven't attended the first webinar or are not familiar with the initiative on democracy and governance, Democracy and Governance is an initiative that has been existing for a few years, but now tries to expand. It is a platform that combines and expands the research expertise on democracy and governance at the University of Groningen. And we also want to relate it to present-day societal issues. And today's webinar, of course, is an excellent example of how we want to operate with people from two different faculties within the university. The order of today is, first of all, that I have to inform you that the webinar will be recorded, but what we will be recording is only the lectures. The discussion and the chats, etc. After the lectures will not be recorded, so the recording is strictly lectures only. What we will be doing today, we'll have two introductions. We have an introduction by Clara Egger and Caspar van den Berg, and on the central theme of the international dimensions of the COVID responses in Europe. Title is New Research Insights into the COVID Responses across European nations and across and within country regions. This title also already kind of predicts what the order will be. First, we will have a lecture by Clara Egger. She is working at the Faculty of Arts as the Director of Studies of the Erasmus Mundus Joint Masters Program International Humanitarian Action. She is a political scientist, did a PhD in Geneva, and published on international humanitarian assistance, on jihadism, and on the international dimensions of COVID pandemic. Next, right after the lecture by Clara, the word goes to Caspar van den Berg, political and social scientist and professor of global and local governance at this university. It's, to be more specific, at the campus Friesland. He has published extensively on European and multi-level and regional governance and bureaucracy, and he is a policy advisor of the government as a member of the Raad voor het Openbaar Bestuur, the Council for Public Administration. The order is that Clara first will present, what she labeled it, the big picture. She will present the an international program on research into responses to COVID, and then after her presentation, Caspar will zoom in on the Dutch case and exemplify the more general picture that Clara has given in her lecture. So, Clara, can I invite you to start this event with your presentation?
With pleasure. Oh, I hear a lot of noise in the background, so I don't know if perhaps it's good if we just turn up. Yeah, good. The mic when I'm not speaking. Thanks a lot for the invitation, and thanks a lot, Dirk-Jan, for the great introduction, although I did my PhD in Grenoble, but well, it's very close to Geneva, so no problem at all. Well, so I will share a few slides, and I hope you can see it, but normally you can see it, right? So the topic of the presentation today is about focusing on two main aspects. So first of all, I wanted to present a project I'm co-coordinating together with Professor Kees Arts from the Behavioral and Social Sciences faculty, trying to analyze what is going on in terms of responses to the COVID-19 crisis in Europe. and then present very, very exploratory results about variations in policymaking across the European Union. So these are very exploratory results, but I thought it was a bit also weird to start with only, you know, sort of a research project, what we plan to do, and not with some, I would say, early results. So to start with, a few words about the project, also hoping that some of you may be interested in joining the team. So it's a project which is called Exceptional Powers in Time of the COVID-19 Crisis. And it's an interdisciplinary project for which we received support of the Zone NV for 2 years, whose objective is to daily map the exceptional measures taken to answer to the COVID-19 crisis in 32 countries of the European Economic Area. So we start the coding on the 1st of January 2020, and we will continue until, well, most probably December 2021, and even after, depending on what is, how the situation is evolving. So we have 3 objectives. The first one is map what we refer to as exceptionalism. So we are really focusing on the impact of COVID-19 measures on democratic governance, the rule of law, international commitments, and human rights. So the idea is to focus on measures that depart from ordinary decision-making. So what is considered ordinary decision-making is, of course, democratic governance and decision-making has framed and regulated by the Constitution and ordinary laws. We focus on the subnational levels. Perhaps you've heard that there's a lot, you know, of research going on mapping measures, but I would say our specificity lies in 3 aspects. So we have a very detailed mapping of exceptionalism. We cover 8 dimensions with, for each of them, 15 sub-dimensions. So that's the first originality. The second originality is that we include enforcement modalities. So not only decision, but how such decisions are actually implemented. And we focus on the subnational level. That I will not focus on the subnational level today, but basically we focus on the subnational level regions, not municipalities, but regions. So based on this mapping that will be, we hope to be done with the first wave, the mapping of what happened in the first wave by the end of the year, and we will continue until the summer, as I said. We intend to assess the political impacts of exceptionalism, and we are especially interested in 2 things: democratic legitimacy and democratic stability. So to do that, we have also set up a side project to collect data on the protests. So what is going on in terms of contestation of exceptionalism in times of COVID-19. The final objective of the project is to understand why there is such variation, right, in answers to the COVID-19, to unpack a bit the determinants of exceptionalism. To do that, it's a sort of an ambitious project. We're working with now 20 partners, and I'm very sorry because I could not put all the logo in the slides, but 20 partners across Europe, co-coordinated by the University of Groningen and the University of Cologne. So what I wanted to do next, once that I've sort of set the stage, is to perhaps show you the puzzle that this is the basis of a paper that is currently under review in Frontiers in Political Science. But we started with this puzzle, right? The puzzle is that there are many reasons to think that we should have seen a more coherent response in the EU to the COVID-19 crisis for several reasons. First, because Europe was the second continent stricken during the first wave, so say the level of uncertainty and lack of evidence was the same and very high. And all the EU countries were quasi-simultaneously affected. So most of the countries of the EU reached the peak of cases in 15 days. So they could have also learned a lot from each other, right? And follow more what others were doing. At that time, there was little to no scientific evidence, and the EU had also very little experience of pandemic management. The last example being what is referred to as the Hong Kong flu in 1968. but it did not affect the EU in such an intense way than the current COVID-19 pandemic. And third, there is a lot of coordination mechanism at the EU level, and they were activated somehow. So we had an integration of civil protection mechanisms. European Center for Disease Control issued a lot of guidelines on how to tackle the crisis, and quite early, I would say, in the development of the disease. The EU activated the integrated political crisis response and used the 2014 EU agenda on health system. So a lot of coordination mechanisms and guidelines did exist at that time. And still, what we observe is very strong variation in terms of policy responses to the COVID-19 crisis, sorry. So to capture this variation, we did set up two key indicators that we plan to also refine in the project. So the first one, and this is the orange graph, I hope you can see it clearly. It's a freedom limitation score. So the idea here is that we did collect all the measures restricting daily liberties, but also fundamental freedom. So freedom of movement, freedom of association, the number of people you were allowed to meet, the severity of the. Sorry, I heard someone asking. No, okay, it's not the question. The severity of the lockdown. So this is what this score captures, right? So what we see is that, of course, there is a variation. So now no country scores 0. So each and all the countries in the EU did take some decision to restrict liberties and daily liberties to fight the COVID-19 pandemic. Not a big surprise there, but still the intensity of the restrictions do vary across countries. So you have a group of countries, around 5, which is Sweden, the UK, Sweden and the UK are in the same group, so with a more limited restriction, and some countries with very high level of restrictions, such as Greece. But overall, I would say the variation is not that big when you look at decision. It is much bigger when you look at implementation and that modality, so what we call the depth of control score. The depth of control refers to the level of, let's say, coercion used in implementing the measures. And here you see that some countries, and the Netherlands is at 0, were not really restrictive in measures, whereas others were highly restrictive. Bulgaria, Greece, Romania, Poland, and here there is also a very interesting case, is that France actually sits in the group of Eastern European countries with a lot of coercive measures. So the second question when we see this graph is to explain, but why is it the case? Why do we see? So what we did is we came up with very different hypotheses, but 3 main decision-making scenarios. So we try to think as how policymakers, what are the type of choices, right, they have to make. So this, of course, the scenarios are not, they are complementary, right? So the first one is the idea that when you face a pandemic, you face a trade-off, right, between what you can do, so the capacity you have to manage the crisis, the severity of the crisis itself, which is partly dependent on the capacity of your healthcare system, and the assumption you make about the level of compliance of the people. So you would rather not implement a very strong response, but sometimes you have to do that because of a lack of capacity, because the crisis is very severe, or because you assume that people will not comply with soft measures. So this is what the policy making as a trade-off scenario is about. The other scenario we came up with takes pandemic policy making as an outcome of institutional constraints. And here, the assumption we make is that, of course, a crisis like the pandemic is an opportunity for especially the executive to seize more power, but not all the executive and not all the governments are equally able to do. some systems are designed to avoid or make more difficult the exercise of exceptionalism by the executive. So we have one hypothesis looking at the check and balances, and one hypothesis looking at the state of emergency. So some countries in Europe have provisions to declare a state of emergency. And we assume that when you have such provision, of course, then after the policies will be more stringent. And then the last hypothesis or scenario emphasizes the role of ideology and takes pandemic policymaking as the outcome of a specific ideology. And here we'll look at authoritarian culture. So the tolerance towards, a more authoritarian rule is different in different. But also we look at the ruling parties' ideologies. Some parties are much more have a more, I would say, explicit stance about authorities. Let's take, for example, Viktor Orban than other parties. So we try to look which of our sort of assess which of this scenario were the most supported by the empirical data we collected. And basically, we find quite, I think, exploratory results that are rather interesting. So in bold, you have the hypotheses that are strongly supported by the data we collected. And I will explain what is the data we collected about, what are the data we collected about. So in terms of pandemic policymaking as a trade-off, what we found is that the overall capacity of a state matters, but not so much the healthcare resources in itself. So really the overall financial capacity of the state matters. The more capacity you have, the less stringent the response will be. And what we found also in the first scenario is the importance of trust. So the more political trust, interpersonal trust you have, the less coercion you use in implementing measures. In contrast, factors related to the severity of the pandemic did not shape the response at all. And I think this is also something quite interesting, is that even if the pandemic is very severe, it does not mean that the answer will be really stringent. The outcome of political constraints is a bit, I would say, ambiguous, mainly because check and balances sometimes partly explain the level of freedom restriction, but they also sometimes partly explain the outcome of the depth of control. And I will show that in terms of ideology, ideology matters too, because the more authoritarian the political culture, then the more likely the response will be very stringent and very coercive. I will not be very detailed on sort of the empirical indicator, because I think it could be, something that we could address in questions. But basically, these are the indicators we use to distinguish between the long-term determinants of pandemic policymaking, the institutional one, and what we call the crisis-related and contextual determinant. The important things to keep in mind is that in terms of, for example, institutional determinants, which is what I would say political scientists are very interested in, what is interesting is that, for example, the state of emergency, so the declaration of a state of emergency, matters to explain the level of restriction implemented, freedom limitation, but does not explain the coercion used to implement such measures. So it does not, because you have a state of emergency declared, that the measures will not only be very restrictive, but also very coercive. We also saw that in terms of institutional determinants, that of the level of check and balances, so the need you have to consult the opposition much more, matters to explain the level of enforcement, so the coercion. So to sum it up, and again, I'm very happy to answer the question, what we found, and I think could be an interesting topic for discussion, is that long-term factors shape how governments react to a sanitary crisis. And this is interesting because, to put it very bluntly, we could have predicted well before the pandemic which governments will react in which way, no matter the strength of the crisis they would face. The role of authoritarian political culture, the role of the overall capacity, and the role of trust are long-term structural determinants that shape the answer much more than things that are more, I would say, conjunctural, such as crisis-related factors, but also political leadership. And what is interesting is that none of our data on the preferences and of the ruling parties matter to explain the type of policy taken. And I think this is something interesting also in light of the existing literature on political science, which puts a lot of emphasis on the role of leadership in crisis. Well, what we found is that there's much more than actually the leadership to explain what actions are being taken in the context of a pandemic. But now I leave the floor to Caspar to completely destroy my argument.
All right. Yes, I'm happy to take over, and no worries of completely destroying your argument, because the one of the things that is proving that these kind of lunch lectures serve a very clear purpose is that because of this initiative, Clara and I actually found out that we were working on very similar topics at the same time, which otherwise we might have found out at a much later point in time. So that is already a huge benefit, I think, at least for me. So the interesting thing is that the study that I will talk about in a minute could actually be seen as maybe an in-depth case study nested within Clara's project, so to say, where we are looking at regional differentiation within one country that is the Netherlands. And I will share my screen in order to show you my slides in this way. I hope it's working. Yeah, I'm going to minimize this. All right. Oh, here it starts. So COVID and the regionalized response in the Netherlands. And as I said, in a way, our study can be seen as a case study nested in the larger project that Clara is leading. And why would it be? What kind of case study would it be? Well, maybe an example of how in a very strong consensus-oriented democracy the COVID crisis is handled, and to see whether indeed that is a system like that is handicapped by its consensus-driven nature, so to say. We are working together with colleagues from Leiden University, the Faculty of Law there. I will say a bit more in that in a. So what I want to talk about in the next 15 minutes is well, COVID and the regionalized response in the Netherlands. 4 points that I would like to make. The first one kind of reinforces what Clara already said, that the corona pandemic hits regions within countries rather than countries as such. I think the map of Europe that you see here right from the beginning shows where the hotspots of corona were in Europe in the first at the beginning of the first wave, and also zooming in on the Netherlands on the other map, we see that sometimes very, not even regional, but very localized hotspots occurred. And of course, as the pandemic spread within the Netherlands, that became more of a regional picture. But even to this day, 8 or 9 months into the pandemic, we see very localized outbreaks of the virus, or very unexpected, very regionally determined places where the virus flares up, and not so much in an adjacent region. So that would be the first point. But then, based on our own research, I want to talk about the question of the regionalized approach in the Netherlands, how the Dutch response swung between countrywide measures, bottom-up variation, and top-down differentiation. I want to spend some time talking about what we call the regional autonomy paradox in fighting the coronavirus, and maybe some more reflective remarks about the question whether induced by Corona, we see sort of a regionalization of Dutch public administration happening under our hands at the moment, so to say. So that's kind of my program. The research questions that we started off with were very clearly driven by curiosity. With a couple of colleagues, we sat together in early April and wanted to find out what did we see going on, what did we think was interested from a research point of view, and we came up with 3 questions. The first is, what scope exists within the Dutch decentralized unitary state for regional differentiation in the COVID response? That's what I'll be talking about. The second is, what role is there for regional specific culture, identity, political, administrative tradition? And this connects very closely, of course, to the research design that Clara was already talking about. Because, of course, when we do international comparative research, the institutional structure, the political administrative tradition is usually seen as a very strong explanatory factor. And logically speaking, particularly in countries where there is a lot of regional autonomy or regional differentiation, why would it not be the case? Why would culture only happen at the nation state level and not below that? What can we say about that in the Dutch case? And also regional variations in public trust, societal discontent. We have had cues over the past years that there is plenty of regional variation in that. For instance, the outcome of some referenda and voting behavior suggests that public trust and societal discontent varies quite a bit from one part of the country to another, and so that's also what we're interested in. I put this here in bracket because for time reasons I won't go into that too much at this point, but maybe we can table that for a later occasion. And lastly, what is the potentially lasting impact of COVID on the design and functioning of regional governance in the Netherlands? I want to say a few points about that. So our team consists of people from the RUG and of Leiden University. My colleague Geert-Jan Boogaard, who is a professor in local government at Leiden University, and people from his group, Roel Becker and Gert-Jan Geertjes. And from the RUG side, it's me and then Sophie Dreef, who's working on her PhD, and Silke Clemens, who is a research assistant in this. We are collaborating with the Dutch Veiligheidsberaad, which enables us to get very easy access to key informants, which has helped a lot. And we have received a small grant from the Ministry of Interior Affairs, which we have matched both from the RUG side and from Leiden University. Well, then to our research strategy. What did we do in concrete terms? We started off by making a comparative legal analysis of all the different noodverordeningen, emergency regulations in the 25 security regions, starting from March 13 up until the present. We also made a media analysis of anything published in regional and national newspapers, where we were hoping to find justifications, substantiation from the regions as to how they were deviating from national policies. And then lastly, in-depth interviews with all the 25 chairpersons of the security regions. And we're currently in phase 3. We are just over halfway in interviewing all these people. So also from my side, the disclaimer that it is not a completed project yet, but we're far enough to share some first insights. And one more kind of methodological remark is that, of course, in this project we're following a moving target, because in April we decided we wanted to see what scope there was for regional variation. Then end of May, the government decided that regional autonomy would be the norm during the sort of exit strategies, the relaxation process. So that was wonderful. We felt that the empirical conditions were really going into the direction of what would be a optimized research setting. But then over the summer, it turned out that that regional autonomy didn't work so well. I'll talk about that in a second. And then later on, what also happened was that in not the last one, but the one before last press conference, the Prime Minister indicated that when the pandemic would get worse in specific places, the government would step in and force regionalized restrictions on the regions. And then, of course, the next week, the level of infections went down again. So also, just when we think that the research conditions are optimizing, then the pandemic does its own thing again. So that's kind of how we've been going back and forth in this research. All right, here you see a timeline of the regionalized response from March up until the present. At the very beginning, of course, when predominantly the province of North Brabant was hit, we started off with a regionalized response, a lockdown in North Brabant, and no restrictions yet in the rest of the country. By mid-March, we went into an intelligent lockdown with countrywide measures where the security regions were able to use a sort of a template emergency regulation and give some substantiated regional specificities to that. In the relaxation period over the summer, actually bottom-up regional differentiation became the norm. But as soon as the rate of infection started to flare up in the Amsterdam and Rotterdam regions in August, that kind of ended again. So it didn't really have the chance time-wise to prove itself. I'll go into that in a bit. And then we went into a period there was a regional approach plus additional countrywide measures with options for regional exceptions, for instance, for buildings, locations with a specific regional relevance, there could be exceptions made. Then as a second wave hit us more, then we went into a partial lockdown, again with countrywide measures with options for regional exceptions, but additional top-down regional differentiation where the government would see it fit. And so the most important thing here to realize is that by June, the general idea was that the big pandemic had been brought back under control. And the idea was that we would not be done with the virus yet, but that probably the virus would flare up in specific regions and specific locations, and the specific security regions there would be able to stamp out, in the words of the Prime Minister, the virus in that region without much interference from the central government, which was an interesting thought, but it didn't work so well, and we were of course puzzled by why that was the case, and we'll go into that in a second. So a couple of things that we found looking at the legal comparison, the legal comparative analysis, which were the regions that deviated mostly from the standardized template of emergency regulations. This is the picture that emerges. The darker blue are the regions with the most deviations. And interestingly, there is not really a clear pattern at first sight that you can think of, maybe more or less densely populated areas, maybe only border areas. It's not really the case. So this is kind of what that empirically looks like, but it's kind of hard to get an unambiguous pattern here. So we needed to delve deeper. But what was also interesting, we wondered when we look at those deviations of the template of the emergency regulations, on what topics were the most deviations or most exceptions made, and that's shown here. This is in Dutch, unfortunately, but the most frequent topics are very prosaically sanitary services, so the use of toilets and showers in nature reserves or on camping sites or other recreational grounds. That was the one where the most exceptions were found. Enforcement, weekly markets, gatherings, face masks, those were the ones that were mostly where the security regions mostly felt the need and the justification to do something different from what was given in the model emergency regulation. Well, so how do we explain those exceptions? There are a couple of factors that we found that are important. Mostly, it's the regional economy. Where we found the exceptions, and this is, for instance, in regions where a specific economic sector is very strongly present. So think of the meat industry, think of mink farms, think of regions that are where tourism is a big chunk of the economy. The coastal regions actually had a lot in common of how they deviated. The cities that have a university, of course, over the summer with the start of the academic year, were the ones that got quite nervous quite soon. So that has been a reason for a lot of deviations as well. The introductions weeks, gatherings by students and so forth. Whether or not a region has many recreation areas, holiday parks, this is where the sanitary services came in a lot. And then there was what we call like the regional DNA or the couleur locale. Think of regional festivities such as the Easter fires in the east of the country, Saint Martin in some parts of the country, and other sorts of regional based events for which specific exceptions were made. And lastly, we do see the border regions to a large extent as a place where exceptions were made, particularly in the north of Limburg, which is bordering on densely populated areas in Germany, where the economy relies a lot on what they call the German days, where Germans come shopping in Roermond and Venlo and those places. But also in Zeeland displayed a role, not so much in the north. But if you are a border region or not does make a difference in the dynamic that you are facing. Then what we call the regional autonomy paradox, right? So what are the basics of this paradox? The basic realization is when the severity of the pandemic varies substantially across regions, countrywide measures unnecessarily harm communities and the economy in specific parts of the country. So from a technical perspective, so a substantive perspective, you would say that regional differentiation would lead to optimized results. And this was also what the line of reasoning of the government was during the months May, June, July, and August to some degree. However, when those regional authorities were given the autonomy to sort of march to their own beat, from a political administrative point of view, this proved to be unfeasible. And of course, in policy science, in political science, in public administration, this contrast between what is the technically superior solution is usually not the political administrative superior solution. And this came in quite clearly in our case. The question is why? Well, we found 4 explanatory factors here. The most important one was the political feasibilities. So authorities felt unable to justify self-chosen differentiation. They couldn't justify, they couldn't explain it to their citizens, to their businesses, and to the media. Why would something be stricter in their region and not 20 kilometers further down in another region? And basically what the mayors who are presiding the security boards are saying is that, well, what we were lacking in June and July was a roadmap that could help us to sort of make automated decisions. If the level of infections would surpass a certain level, then automatically more stringent measures would take place. But that roadmap, so to say, only came in mid-September, way too late for these executives for them to be useful, because by that time already the second wave had set in and things had been re-centralized, so to say. So the idea that those mayors can they didn't want to serve as the lightning rod for all of the discontent on this. So political capital, political administrative capital, they didn't want to burn on this. The second main explanation is enforceability. So enforcement officers were, particularly in more rural areas, very much lacking. So why would a chairperson of a security region announce more stringent measures if they knew they weren't able to actually enforce it? So therefore also they took a reluctant stance towards that. Then spillover effects, also called waterbed effects. Maybe the security regions are, territorially speaking, too small to prevent people from traveling from one region to another. So when you close bars and restaurants in one region, it will get very crowded in the bars and restaurants on the border of another, on the other side of the border with another region, of course, with all sorts of negative consequences of that, both in terms of enforcement, but also in terms of actual infections. And fourthly, one measure that is really underemphasized in the media, but when we talk to the mayors, plays a huge role, the financial liability. When a decision is made at the central government level, when the cabinet says these kind of places need to shut down, these kind of businesses need to shut down, the financial liability comes for the bill needs to be picked up by the central government. And of course, at the regional level, there is no such financial slack to compensate victimized sectors. And when the mayors of Amsterdam and Rotterdam over the summer saw that the level of infections was rising in their jurisdictions, the first thing they did was not announce stricter measures, but they went to the late night talk shows and said, we want the central government to step in and to come with their nationwide measures again. And a lot of that has to do with the fact that going alone and being financially responsible for the damage, the economic damage that would be done, would be unfeasible. And this is so the financial economic consideration there is something that played a larger role than what we have read in the newspaper so far. And my last point, and then I'll give the floor back to Wolfram. Real-time regionalisation. What we've seen is that the structure of the security regions that we've seen always was an auxiliary structure meant to help out in times of acute crisis. So think of a flooding, think of a plane crash, think of some other really acute crisis. And it never happened before that all of the 25 of the security regions at the same time had to deal for a longer period of time with an emergency situation. So what we've seen in the past 8 months is that an auxiliary structure basically became a main structure in domestic governance. The way in which the security regions have been organized is really meant to focus on acute crisis management. Also, their size and their scale are to a large extent dictated by the time it takes for emergency services to reach a certain place, so to say, and not meant for midterm governance as we see now, let alone long-term institutionalization. But we've entered a situation in which we're no longer in acute crisis management. We are in midterm governance, and the question is, how long is that sustainable? Because we have decisiveness that we need in acute crisis management is, of course, justifies the democratic deficit that happens in the decision making. However, what we see now, the longer the pandemic continues, that the decisiveness argument loses strength and the democratic deficit downsides are increasing. And also what we see is that it depends very much on the individual style and preferences of the chairperson of the security region, to what extent they keep in touch and they keep the constituent local councils updated. So some say it's my job to keep the councillors at the local level up to date and to keep them connected. Others say, well, it's still in a grip 4 situation. The rule is that you govern and you are accountable only after the fact, so to say. So there's a lot of variation that is arbitrary in the sense that it depends on the person, the personal views, the personal interpretation of the chairperson of the security region. And from a democratic point of view, obviously that is quite problematic. And then lastly, we see forces both at the central government level and in some of the regions to say, well, this regional scale is working quite well. It's surprisingly, people are surprisingly positive about this. Can we do more at that scale between the provinces and the municipalities? But then the question is, we have 49 different functional regional structures, so to say, and which of those regional scales between the municipality and the province would then be the right one to focus on. So the debate that we're currently in, also in the run-up to the elections and the formation of the new government, what kind of agenda for regional governance, what are the lessons learned, and what are the push and pull forces for further regionalization are very much high on the agenda, where the forces looking at more differentiation in task divisions across different parts of the country and more experimentation seem to be on the winning hand. So we'll see how that plays out in the next months, and particularly during the cabinet formation after March next year. All right, thanks very much.